Now, you are a physician who's very busy because not only we've talked about the screening, but you treat individuals who might have difficulty with wounds healing. Is that correct?
Correct.
Too? Tell us a little bit about that process and our special equipment that we have at Heart Memorial Health and how that helps the community.
Well, I first got involved with wound healing because many of my patients will present with a non-healing sore on the leg from ischemia, lack of blood flow from blocked arteries, from peripheral artery disease in the legs. And many times we can restore the blood flow, but there are still problems that prevent the wound from healing completely. Small vessel disease that cannot get a bypass, that cannot be treated with anticoagulation. Diabetics have a much higher rate of that, for example. Those patients, then we can have a multidisciplinary assessment of their nutrition, of their functional status, their mobility, their protection of the surfaces. Pressure can be an aggravating problem. Treat their ischemia, and many patients, depending on their wound and their indication, we can use hyperbaric oxygen therapy to try and help improve their wound healing rate. Hyperbaric oxygen therapy is where a patient then is placed into a chamber. We use monoplace chambers here at Heart Memorial, and we have them to go down to 2 to 2.4 atmospheres of pressure, similar to how a scuba diver dives. They will then be increased pressure of oxygen. More oxygen in the blood from the increased pressure allows it to go further into the tissues at higher concentrations. That helps fight localized infection. It also helps the development of good small blood vessels into the wounds so that more of the things that promote wound healing are there to help try and close the wound.
So it helps then progress the healing process, correct? How long, and I know this is based upon the type of wound and the patient, but generally, what is a treatment length?
One treatment session is 90 minutes at pressure for the typical wound healing protocols. Certain difficult wounds, such as with radiation damage from radiation therapy, they require a longer period of time and higher pressures, but that's getting into technical things of individual patient situations. But it takes about 12 to 18 minutes to come down to pressure, 2 atmospheres, because it's like scuba diving. You have to clear your ears. And then it takes 12 to 18 minutes to come back up to sea level. We use the scuba terminology when we talk about how deep somebody may be or the atmospheres that they do, because hyperbaric medicine therapy began originally with the treatment of the bends, diver's sickness, from nitrogen sickness from that. And that's where hyperbaric therapy originated and was found 50 years ago to promote wound healing in some situations when it was investigated. An average patient probably will have at least 20 treatments because it is, I'll tell patients it's like running a marathon, it's not like running a 100-yard dash. One treatment doesn't magically make the wound close. It takes time to promote the angiogenesis, the growth of the small blood vessels in the wound bed, along with everything else that you do, such as, again, making sure nutrition is addressed, the ischemia has been, gross ischemia has been corrected, to get healing. Most diabetic foot wounds, we probably have 30 to 40 treatment sessions. I would love for it to be only 1 or 2 for the sake of the patient, but realistically, it's a slow and steady modality that has helped heal a lot of wounds in the 5 years we've been doing it that I don't think ever would have healed otherwise.
Now the patient, is that usually once a week or?
It's 5 days a week.
5 days a week, okay. And they are in a comfortable setting, basically.
The vast majority of our patients probably end up taking a nap because the beds that are in the hyperbaric chambers are like a cot. Granted, it's not a 13-inch Tempur-Pedic mattress, but it is certainly comfortable enough that many patients just end up taking a nap. Our hyperbaric chambers have piped-in electricity and visibility of DVD consoles. We've had patients come in with their music. One gentleman had Marvin Gaye music that he would listen to on a regular basis. I know some of my older patients, a couple of them are big History Channel fans, and they'll just watch the History Channel on the DVD while they have their session going. Actually, we become sort of a little bit of a family here with all the patients since we see them on such a regular basis, and we almost, our staff kind of know the channels by heart of the patient they want to see, or if it's okay, time for my nap, and obviously we still monitor and check on them, but we're not going to wake you up every 3 minutes to see if you're okay if you want to get a nap.
Right. Now, along with, is there a dressing, do they have dressings and different things too that then have to be addressed after they leave the chamber?
Yes. In the chamber itself, there's only cotton clothing, and many of the dressing modalities we have to take off. Part of hyperbaric oxygen safety is attention to the safety of the concentrated oxygen, and so we cannot have anything that is an ignition source. So you are very bare in the chamber, but once you're back out, then many patients, maybe it's just saline and gauze. Some patients need Silvadene ointment or Santal ointment to help debride some of the necrotic dead tissue that develops in wound beds. Many patients get a collagen, a fibrocol-based type of dressing to continue to promote the scaffolding of epithelium and skin in. Other patients may need something for helping wounds that are still draining a little bit. And we have multiple topical adjuncts across the spectrum depending on what our patients need. Larger wounds, and if they're deep and very much like a cavity, we also offer and supervise vacuum-assisted closure therapy with one of the vacuum-assisted devices that's out there to try and help close the wounds faster.
So it sounds like a lot of advancements have been made in wound treatment and healing process over the last 10 to 15 years, correct?
That's very correct.
So wonderful that we have this also here in our area for individuals to look into. They talk to their healthcare professional. I'm sure they're recommended to come to the wound center. Is that correct?
Many of our referrals come from the primary care world, where a physician may identify that a wound has been there and not responded to simple office measures over a period of weeks, and we can help with that. We also are getting many primary referrals from our rehabilitation and nursing homes, because there's obviously a class of wounds in that population because of their particular comorbidities.
And I was thinking too, Dr. Veldenz, that we want to stress that while they're in the chamber, I know we're trying to get the wound to heal, but everything is very confidential and privacy is very utmost.
Correct.
So I think that's important for everybody to know, but an opportunity really to look at some other ways of treating and healing wounds. Dr. Veldenz, thank you for sharing this important information with us today about our risk factors and also treatment of wounds today. This has been great wealth of information, and we encourage everybody to go to our website at www.hmh.net for more information. You can click on our services and then also visit HealthLink for more health information. We hope you tune in next month for another important edition of Health in the Heartland.